aí pessoal, tudo bem? Estamos aqui então direto de Chicago, no SBU São Paulo in situ, trazendo as novidades para vocês do que tem acontecido aqui. E a gente acabou de ter uma ótima palestra aqui do Dr. Mohit Khera, que é o atual presidente da SMSNA, e vai trazer para a gente algumas palavras a respeito da testosterona, né? E tudo que a gente tem envolvido hoje em relação ao cenário do uso da testosterona. Mo, thank you for coming with us for SBU. And actually, you give an excellent talk about testosterone now, and we are all waiting for transverse about cardiovascular risk, but we have to understand some things about testosterone. I mean, first thing, it's not bad for cancer, for prostate cancer mainly. And you gave an excellent talk about being a biomarker. Could you meet some words about this?
Sure. So for many years, we were worried that testosterone causes prostate cancer. It started in 1941, Huggins and Hodges, but it was based on one patient. So now we know that in 2018, the AUA guidelines came out, and the AUA guidelines gave a strong recommendation that testosterone does not increase the risk for prostate cancer. Strong recommendation. So since those times, we now feel more comfortable giving testosterone to men. Look, let's be honest, many urologists still give men testosterone to men after radical prostatectomy, and so I think now we are getting much more comfortable. I gave a talk earlier about biomarker. Testosterone, low testosterone in many cases is a risk factor for having prostate cancer. The reason being is when you have low testosterone, your PSA comes down. So actually your PSA is underestimated. And when you give the testosterone back, the PSA goes back into its normal range. So I get very worried when I have a patient who has low testosterone and the PSA looks normal. I think maybe it's higher than it looks.
Yes. And another thing is it's important to do, it's about the sensitivity about the androgen receptors.
Yes.
Yes. So, I mean, you talked there, I asked about it. You have bone health concerns, you have the obesity concerns, diabetes, and eventually these men don't have sexual matters and they have low testosterone. Do you believe you start to use this as a biomarker too, of body health and something like that, and treat these patients with no concerns about sexual health?
Yes, I think that testosterone is the best marker for men's health overall. It is a marker for cardiovascular disease, it's a prostate marker, it's a marker for diabetes, it's a marker for bone health, sexual health. And so sometimes when men's testosterone levels get low, they are going to have sexual dysfunction. But I'm worried about other things. I'm worried about cardiovascular disease, diabetes, and bone health. So I think that we have to be very careful. A man who comes in with a testosterone level of, say, 150, I'm worried that something bad could happen to them.
So, fantastic. So we are waiting for the transverse. June, you said that?
June, this year, June 16th, at the ENDO meeting in Chicago, they will be releasing the results. So 2 months away.
Okay. Fantastic, Mo. Thank you very much.
Pleasure.
And we wait you in Brazil again next year.
It's a pleasure.
My pleasure.
Thank you so much.
Thank you.
Thank you. Thank you.